English Practice Part 1.
Good morning. Please have a seat. What brings you in today?
Good morning, doctor. I've been feeling unusually tired for the past couple of weeks, and I'm not sure what's causing it.
I see. When you say tired, do you mean physically exhausted, mentally drained, or both?
Mostly physically, but I've also been having a hard time concentrating at work, which isn't like me.
Have there been any changes in your sleep patterns or appetite recently?
Yes, I've been sleeping more than usual, but I still wake up feeling like I haven't rested at all.
That sounds frustrating. Are you experiencing any other symptoms, like headaches, dizziness, or shortness of breath?
Actually, yes. I've had mild headaches on and off, and sometimes I feel lightheaded when I stand up too quickly.
Have you noticed any recent weight loss or gain, even if it's unintentional?
I think I may have lost a few pounds, but I haven't been tracking it closely.
All right. How about your stress levels? Have you been under more pressure than usual lately?
Work has been more demanding lately, but I didn't think it was affecting me this much.
Stress can definitely impact your energy levels and concentration. Let me ask, do you have any chronic conditions or are you on any medication?
No chronic conditions, and I'm not taking any medications regularly.
That's good to know. Do you smoke or drink alcohol, and if so, how often?
I don't smoke, but I usually have a glass of wine a few times a week with dinner.
That seems moderate. Have you had any recent illnesses, even something like a cold or the flu?
I had a mild cold about a month ago, but I recovered quickly.
Thanks for sharing all that. I'd like to run some blood tests to check your iron levels, thyroid function, and rule out any vitamin deficiencies.
That makes sense. I was actually wondering if it could be anemia or something similar.
It's definitely one of the possibilities we'll investigate. I'll also check your blood sugar just to be thorough.
Should I fast before the blood test, or can I do it right after this appointment?
Ideally, it should be a fasting test, so I'll have you come in tomorrow morning before breakfast.
Got it. And in the meantime, is there anything I should or shouldn't do?
Try to maintain a balanced diet, stay hydrated, and get some light exercise if you're up for it.
All right. I'll do my best to take it easy and not overthink it until we get the results.
That's a good approach. I'll schedule a follow-up for next week to go over the test results with you.
Thank you, doctor. I really appreciate you taking the time to listen and not just rush through.
Of course, your well-being is important, and I want to make sure we get to the bottom of this.
I feel a bit more at ease now just knowing we're doing something about it.
I'm glad to hear that. See the nurse on your way out to arrange the lab work and follow-up appointment.
Will do. Thanks again for your help. Have a great day, doctor.
You're welcome. Take care, and I'll see you next week.
English Practice Part 2.
Welcome back. I've reviewed your test results. Thanks for coming in today to go over them.
Thanks, doctor. I've been curious and a little nervous about what they might show.
I understand. The good news is that most of your results are within normal range, but there are a few things we should talk about.
Okay, I'm listening. What did you find?
Your iron levels are a bit low, which could explain your fatigue and occasional dizziness.
Oh, I see. So, it could be a mild case of anemia?
Exactly. It's not severe, but it's enough to affect your energy and concentration.
That would definitely make sense with how I've been feeling lately.
Your vitamin B12 is also slightly below optimal, which can contribute to fatigue and brain fog.
I had no idea that vitamin levels could affect me that much.
Many people underestimate the impact of these small deficiencies, but they can really drain your body over time.
So what's the next step? Do I need supplements?
Yes, I'll prescribe an iron supplement and a daily vitamin B12 for the next 3 months.
Should I take them with food or on an empty stomach?
Iron is best absorbed on an empty stomach, but if it causes nausea, you can take it with a light meal.
Got it. And how long will it take before I start noticing a difference?
You may start to feel more energized in 2 to 3 weeks, but full improvement could take a couple of months.
That sounds manageable. Should I change my diet too?
It would help. Try to include more iron-rich foods like leafy greens, lean red meat, and legumes.
Okay. I'll make a conscious effort to eat better. What about B12? Are there specific foods for that?
Yes, animal products like eggs, dairy, and fish are good sources. If you're not getting enough from food, the supplement will cover the gap.
Perfect. I've been skipping breakfast a lot, so maybe that hasn't helped either.
That could definitely play a role. Your body needs fuel to function properly, especially in the morning.
I really appreciate you explaining everything in detail. It makes it easier to follow through.
I'm glad to hear that. The goal is to help you feel better, not just hand you a prescription.
Should I come back for another blood test after the 3 months?
Yes, we'll repeat the blood work to check your progress and adjust the plan if needed.
All right. I'll mark that on my calendar. I'm actually feeling hopeful now.
That's what I like to hear. Healing is a process, but you're on the right track.
Thank you, doctor. It means a lot to have someone who listens and explains things clearly.
You're very welcome. Don't hesitate to call if you have questions or any unusual symptoms.
Will do. Thanks again. I'll get started on the supplements right away.
Take care, and I'll see you in a few months for your follow-up.
English Practice Part 3.
Welcome back. It's good to see you again. How have you been feeling since we started the supplements?
Honestly, much better. I have more energy during the day, and I've been able to concentrate at work again.
That's great to hear. Have the headaches and lightheadedness also improved?
Yes, both have become less frequent. I still get a mild headache once in a while, but nothing like before.
That's a positive sign. Have you been taking the supplements regularly as prescribed?
I have. I even set a reminder on my phone so I wouldn't forget to take them every morning.
Smart move. And how's your diet? Have you made any changes?
Yes, I've been eating more vegetables and lean meats. I also stopped skipping breakfast.
Excellent. Those small changes really do add up over time.
I've also started walking in the evenings, just to stay active. It actually helps me sleep better too.
I'm really glad to hear that. A light exercise routine can make a big difference in overall wellness.
Honestly, I didn't realize how much of my energy problems were connected to these things.
Most people don't until they go through something like this. But the important thing is, you took action.
True. It was hard at first, but now it feels like a routine I can actually maintain.
I took the liberty of reviewing your recent blood test results before you arrived.
Oh, right? How do they look this time?
Much improved. Your iron and B12 levels are back within the healthy range.
That's such a relief. I was hoping the numbers would reflect how I've been feeling.
They do. Everything points to you being on the right track. You've done a great job following the plan.
Thank you, doctor. I'm really grateful for your guidance. It made the whole process less overwhelming.
I'm happy to help. From here, I suggest continuing the supplements for another month, then transitioning to just maintaining your diet.
So I can stop the pills soon?
Yes, as long as your diet continues to support your needs. I'll give you a list of foods to prioritize.
That would be helpful. I don't want to end up in the same situation again.
Totally understandable. Prevention is always better than treatment.
Should I come back again in a few months just to be sure?
A follow-up in 6 months would be ideal, just to make sure everything stays on track.
All right, I'll make a note of that and schedule it with the receptionist.
Sounds good. You're doing great. Just keep up the consistency.
Will do. Thanks again for everything. This experience has really changed how I take care of myself.
That's wonderful to hear. Take care of yourself, and I'll see you at your next checkup.
English Practice Part 4.
Well, it's great to see you again. You look much more refreshed than the first time you came in.
Thank you, doctor. I honestly feel like a different person now compared to a few months ago.
That's always good to hear. Before we begin, is there anything at all that's been bothering you lately?
Actually, no, my energy levels are back to normal. I sleep well, and I haven't had any headaches or dizziness.
Excellent. That matches the results from your latest blood work. Everything is stable and in the healthy range.
That's such a relief. I was secretly a little nervous the symptoms might come back, but they didn't.
That's because you took the necessary steps and followed through consistently. You've done really well.
I appreciate that. I've tried to be more intentional with my health habits ever since our first consultation.
It clearly shows. Sometimes, it only takes a few consistent changes to make a lasting impact.
I still take my multivitamin and try to eat balanced meals. It's become part of my routine now.
That's the key. Long-term consistency, not perfection. I wouldn't recommend any further testing at this point.
So, no more checkups unless something comes up.
Exactly. You're in a good place now. Just listen to your body and check in if anything unusual happens.
That's a relief. It's nice knowing I don't have to worry about appointments for a while.
You've earned a little break from the clinic. Just keep doing what you've been doing.
I will. Honestly, this whole experience has taught me to never take my health for granted.
That's one of the best takeaways. Prevention is far more powerful than any treatment.
Thank you for being patient with me during the early stages, when I had no idea what was going on.
It's my job, but I also believe listening is just as important as prescribing something.
That made a huge difference. I never felt rushed or ignored during any of our appointments.
I appreciate hearing that. It means a lot to know the care made a positive impact.
It definitely did. I've even encouraged a few of my friends to get regular checkups.
That's great to hear. You're setting a good example.
Well, I guess this is goodbye for now. Hopefully, I won't need to see you again anytime soon.
I hope so too. In the best way possible. But you're always welcome back if you need anything.
Thank you, doctor. I'll take care of myself and come back if anything ever feels off.
That's all I can ask. Stay healthy and enjoy the energy you've worked so hard to get back.
Will do. Thanks again for everything. You really helped turn things around for me.
You're very welcome. Take care, and live well.
Please subscribe, like, share and comment. Thank you.